Hello, today we will talk about blood urea nitrogen test. This test determines the amount of nitrogen in the blood of the patient. Nitrogen is synthesized from urea, which is formed by breakdown of proteins in the liver. After formation, urea is released in urine. Why is this test done? This test is a normal part of kidney function tests and is done to assess the functioning of kidneys. How is this test done? For this test, a blood sample is required, which is usually collected from the arm of the patient. Is there any special instruction that is given before the test? Usually, no special instruction is given before the test and the sample can be taken after 6 to 8 hours of overnight fasting, but it is usually advised to avoid heavy protein diet at least 24 hours before the test. What are normal values for this test? The normal values for this test range between 7.9 to 20 milligrams per deciliter. However, these values can vary slightly as per different laboratories. What conditions can cause increased blood urea nitrogen? Increased blood urea nitrogen can be due to diseases like kidney failure, diabetes mellitus, dehydration, etc. Other diseases like Addison's disease, severe burns and shock can also result in decreased blood urea nitrogen. Decreased blood urea nitrogen may be due to liver diseases, liver failure, malnutrition, or simply due to a diet which is deficient in proteins. Rare diseases like rhabdomyolysis and syndrome of inappropriate antidiuretic hormone can also result in decreased blood urea nitrogen. Can medicines affect the levels of blood urea nitrogen? There are many common medicines which can affect the levels of blood urea nitrogen like diuretics, chloramphenicol, tetracycline antibiotic, etc.